Today I'm joined by Associate Professor Dr. Aziz Rahman. Aziz is an Associate Professor of Public Health at Federation University and Associate Dean of Research in the School of Health. Aziz is a highly respected public health physician and researcher and has published over 100 research papers in highly ranked journals, including the New England Journal of Medicine, Lancet, British Medical Journal, and has over 19,000 citations. Aziz has also obtained over $9 million in research funding so far in his career. Aziz's key areas of research include health promotion and non-communicable diseases within the discipline of public health. And this is something I'd like to talk to Aziz about today. Thank you for joining us, Aziz, and welcome. Thank you for your time.
Thanks, Michael, for inviting me. That's really a great pleasure.
As an expert in public health research, how would you define public health?
Public health, if I look at the definition that is given by American Public Health Association, they have defined public health as a branch of science which promotes and protects health of community people, prevents people from getting sick or injured, and promotes wellness by encouraging healthy behaviors. And that includes almost all the components of public health.
And what about the difference between medicine and public health?
Thanks, Michael. So that's a really good question because people think whether public health is a branch of medicine and what is the difference. So if we want to compare medicine and public health, the branch of medicine deals with individuals, whereas public health deals with the entire population. While medicine deals with disease diagnosis, treatment, and care of individuals, we as a public health professional, our focus is more on the disease prevention and health promotion.
And what is the core function of public health?
So if we want to look at the core function of public health, and it is also linked with what are the areas that public health professionals can work. So the first thing is about generating evidence through research. That is the key area of public health, because once we know the evidence, then we can apply this thing to change the practice or improving the health outcome of the population. So the first function is the research or evidence generation. The second one is influencing on policy or practice. That's called the research translation. So it's not only about generating the evidence, but how the evidence can be utilized to improve the health outcome of the population. So that could be by forming a policy or changing the policy or changing the practice. So that's what we call research translation. And the third one is education and training, because it is also not about getting that research evidence or the practicing, but we need to train the next generation public health professional. So another function I will say there's the education and training.
Great. I'll talk to you a bit more about that translation process a bit later on. But before we do that, there is a common myth that public health is only suitable for medical doctors or other health professionals with health backgrounds. Is that true or not?
That's a really a very common myth, Michael. So, which is obviously not true. In public health, people from multidisciplinary background can contribute to improving health and well-being of the global population through their diverse knowledge and expertise. To solve a public health issue, we need the expertise of the multidisciplinary people. For example, if you just think of the different branches of science, that's not the only population that we need to resolve a problem. If you think of a journalist who is not relevant to any of the medical or health science, but that journalist can also contribute to public health to resolve a problem, because what they can do, they can write an issue of public health in more informed way if they know about public health issues. A lawyer can deal with public health issue and they can deal with different public health policies. A nutritionist can contribute to reducing the risk factors of many diseases. Even an engineer, that engineer can also help in public health engineering. There are lots of interventions that would depend on engineer. So it is truly multidisciplinary. It's not only the people from the health background, they can do public health, but it is a multidisciplinary. To solve a problem, we really need to have the support of all these multidisciplinary people. And I'll just tell one example of this COVID-19, and we can see it is not only the health professionals, but many professionals are involved to solve this issue.
Thank you. That's a very interesting point of view. And yeah, I never thought that journalism would be involving public health, but what you said makes a lot of sense. Let's talk about some of the public health strategies that have been developed in Australia over the past few years that has been quite successful. Can you maybe run through some of these successful public health strategies in Australia?
Sure. Thanks, Michael. So I can tell a little bit about what happened and what are the few success stories over the last 20 years in Australia. If I list the top 10 public health success, the first one I will mention is about use of folate. So to reduce the neural tube defects, by advising the pregnant woman to take folate supplement or folate fortification in bread, there was a dramatic drop in incidence of neural tube defects. So that is a great success of this public health. Second one I will mention about the immunization disease elimination, and Australia is regarded as having the most robust and comprehensive immunization system in Australia. Specifically the success for measles, rubella, meningococcal disease and rotavirus, they're really quite ahead of other countries in the world. The third one I will mention about the containing the spread of human papillomavirus and related cancer. We have a very good national cervical cancer screening, and this human papillomavirus vaccination assisted in reducing the incidence of cervical cancer. The next one I'll mention about the oral health. So community water fluoridation, that was the strategy that started back in 1960s to prevent dental decay. And it is covered by almost 90% of Australian population now. It is really unfortunate that 10% of the population can still access this community water that is fluoridated, which prevent dental decays. And besides preventing child oral health services were also launched, which is also another success story. We can see at the school there is a periodic check of this dental oral health of the children. So that is really a good initiative of the government I will mention. The next thing I will mention, I'm pretty sure that you are quite familiar with this slogan, slip, slop, slap. So to reduce skin cancer in young adults, that was really a quite popular campaign in schools. The next one I'll mention about the tobacco control. And Australia is the pioneer in tobacco control, and that is the success of all of these tobacco control advocates and the public health professionals. For this, very few people are dying due to smoking here. And few success stories of this tobacco control I mentioned, say for example, plain packaging or increased tax that reduce smoking among the population. Another one I'll mention is about the road safety. So bringing down road deaths and injuries, that's also another success of public health. Gun control, reducing gun deaths. And that is in contrast to many developed countries. Australia significantly reduced incidence of mass shootings since 1996. If I want to conclude with another two examples, one is sustained low prevalence of HIV and AIDS. That is also another success story in Australia. And the last one is cancer screening, success to detect the cancer early, specifically the bowel cancer and breast cancer. So there are many examples, but I've just highlighted top 10 public health success stories over the last 20 years, Mike.
Let's talk about research translation. I know as an expert researcher in this field, can you maybe briefly talk us through the process of how to translate research findings to policy and to strategy development?
Thanks, Michael. So research translation is the process of moving research ideas from labs or from the computer to clinics, to practice, and to policies. Because the creation of knowledge does not itself lead to widespread implementation and positive impacts on health. This knowledge must be translated into changes that can influence the practice, that can influence the policies for benefits and impacts to flow to the population in Australia or globally. Another term is used is called knowledge translation, so which is about getting the right information to the right people at the right time and in a format that they can use so as to influence the decision making. And the ultimate aim is to create an impact on improving population health outcomes. So if I mention about the strategy, say for example, for tobacco control, so if you think of just the research is not enough, but how we are going to use that research finding to change the policy or to change the practice in tobacco control. So that is called the research translation, and how the advocates or how the policymakers can utilize those research findings to change the policy. So that's called the research translation. So whatever we do in public health research, if it does not impact on the population health outcome, or if it does not impact on improving the patient outcome, so there is of limited use of that research. So we always try to think of how our research can be utilized to improve the population health outcome.
Thank you very much. And I guess the other aspect would be also to monitor the impact of the particular strategy over time. And as we know, with COVID-19, things can change very quickly, and there's been different policy that's been developed and so forth. So I guess this leads us to the last question I want to talk to you about, which is a hot topic currently with COVID-19, and to do with public health and well-being, is to do with vaccination. And we know that COVID vaccination is a well-discussed topic currently. I think we are doing quite well as a nation in terms of the vaccination rates going up quite rapidly. However, as you know, there are still some people or some population that are resistant or be hesitant to vaccination. What are your thoughts on vaccine hesitancy? Why is your hesitancy amongst the public?
Thanks, Michael. So as you have mentioned, Australia is really doing good, and we are really privileged to have lots of public health support, government support in Australia compared to many other developing countries and even in developed countries. And for all of these public health restrictions, probably we have very low rate of infection and death around the world. Now, in terms of vaccine, and I'm pretty sure that people don't understand this thing, that vaccine is the greatest blessing of public health over the years. And during this current pandemic, vaccination is the only solution to get back our freedom. And probably people have understood that issue and then coming forward to get the vaccination. But as you have mentioned, still there is hesitancy on vaccination. And now this hesitancy, scientists have worked on this thing. Why people behave like this? Why people don't want to take vaccine? And this is not only during this COVID, it also happened during the other immunization program. So what scientists came up with, they analyzed the behavior of people. What are the psychological factors that may impact on vaccine hesitancy? And there are different models that explain why people are not, why they are confused to take the vaccine. And one of the key models that I can mention today is called the 5C model. So there are 5 C's. One is confidence. The people need to be really confident, and they need to believe, yes, this vaccine is protective. And if I tell about this COVID, they need to be confident, yes, it will protect them from COVID-19. The second one is complacency. Complacency means whether people think, okay, if I don't take vaccine, will I get sick with COVID? So that is the thing regarding their susceptibility, whether they will be infected, whether they will have an impact on their health. So that is the complacency. Third one is calculation. Whatever we say as a public health professional or the health professional or from media or source, people individually calculate their own risk. What are the things that they need to do? If they take the vaccine, what are the benefits? If they don't take the vaccine, what are the risks? So they do their own calculation. So that influences their decision. And the next one I will mention is called convenience or constraints. So what are the issues that they need to consider to get that vaccine in terms of starting from vaccination booking and then going on the vaccination day, being in the long queue, and what are the sacrifices that they need to do, whether they need to take leave from a job and all of these things. So they need to consider all of this convenience or constraints. And the last one is collective responsibility. We know this COVID vaccine, it protects us from getting the serious illness, but it doesn't protect us from getting the COVID again. But there is evidence that it will also, if we take COVID vaccine, it will also prevent transmission in the community. So if I don't think about this collective responsibility, if I don't think, if I take the vaccine, I am also benefiting my entire community. If that thought process is not there, people will be reluctant to take vaccine. So that's the 5C model: confidence, complacency, calculation, convenience or constraints, and collective responsibility. People decide on all of these issues, and any of those factors influence them to take the vaccine. And I'm pretty sure that people should understand. And if there is another issue is about this I would say, infodemic, because people look at different unauthentic source in the social media and then they try to believe this thing, and that impact on their belief. So it is really important that they go to the authentic source, so they clarify their confusion and move ahead to get the vaccination, so that all of us can manage this pandemic in Australia.
And what about your thoughts on a vaccine passport? Is that a good thing?
I think it's a good thing, because the people who comply with this public health message and who comply with this thing, yes, there is an issue of freedom. People may choose not to take the vaccine, but they need to accept this thing. If they don't take vaccine, so they will be deprived from some of these benefits, including the international travel. So I don't see any issue there, because the people who comply with this thing, we definitely need to reward them, and that is the majority of the population. We have confidence that majority of the Australian as well as the global population, they comply with this thing, and there will be few people who will be resistant in those compliance. So I guess it is fair enough to get some benefits for the people who comply those public health messages, including having the vaccination.
Yeah, I agree. I agree too. And I think that certainly will help address some of the 5C models that you mentioned there to get them motivated to get vaccinated. Yeah, thank you, Aziz. I think we'll end the interview there. Thank you for your expert opinion and input. Really appreciate your time.
Thanks, Michael. Really appreciate it.